Hi, my name is Greg Felt. I'm Director of Public Health in Sheffield. This is the situation report for today, the 26th of January. Firstly, the epidemiology. Cases, as measured by the infection rate per 100,000 people over a week period, is declining. However, the rate of decline is beginning to level. So currently, as of today, we're on about 230 per 100,000. Week and a half ago, it was about 350 per 100,000. So you can see it's come down, but the rate of decline has now levelled. A reasonable number of outbreaks, defined outbreaks in certain settings, those are largely contained. The business end of transmission always has been household to household spread, people meeting and connecting chains of infection together. That's how this has always spread. Principally working age people. Certainly, if you look at the age specific rates, what's driving the rate, the force of infection is the working age population, particularly younger working age population. Important that we all reflect on that. Important that we all continue to obey the rules, because the rules matter and the rules have saved lives. I've said on a number of occasions that the course of the epidemic can flip really quickly. We may be approaching another flip point. As I say, with the rate of decline is now stalling, it would seem. In another week we'll know definitively. It's stalling at a very high cruising altitude, and an altitude that still causes significant harm and still leaves us with not very much wiggle room here. So sticking with the programme will remain important. This still is a virus that kills people really quite frequently. Hospitals and intensive care units have a significant number of people who have severe illness from COVID, and that pressure is not going away. If anything, it might be getting slightly worse as the winter draws on. In the order of 20% of hospital beds have someone who has COVID in them. That's a significant number. That means 20% of beds are unavailable to provide care for other people. That really matters. So it encourages all to remember that this is an illness that is relatively mild for many, but causes very, very severe illness that requires hospitalisation, and that has consequences. The cohort, certainly the cohort of people in intensive care, is younger than you might imagine. I would guess that most people think intensive care has a very, very elderly age group in there, that the people that have COVID. That's not the case. It's actually much, much younger. So this is something that doesn't only affect the very old, it also affects younger elderly people, and actually still people of working age to quite a high degree, and that is a concern for all of us. The variant, the B117 variant, significant proportion of all cases diagnosed in Sheffield are of the new variants, certainly well more than 60%, and that's continuing to grow. I think it will be the dominant variant before too long. It was always going to be relatively unstoppable, and that's proven to be the case. It's more transmissible, no doubts about that. It's significantly more transmissible. The control measures are exactly the same as the wild type virus. Washing our hands, keeping a distance, wearing a face covering, limiting our social contacts, getting a test if you've got symptoms. That hasn't changed. What has changed is the need for vigilance. Because it's much more transmissible, we need to be a lot more vigilant, and really, really, really obey the rules, because not obeying the rules may have consequences for you and your loved ones, or may have consequences for somebody else's loved ones. Emerging over the weekend was that this is a more lethal disease. So there was some data that was published by Sage over the weekend. Its initial analysis, and this may change over the course of the next few weeks, but certainly Sage were of the view that infection with the B117 variant causes more deaths. So the standard wild type virus causes in the order of 11 deaths per 1,000 people. The new variant causes in the order of 16 deaths per 1,000 people. That seems like a fairly trivial difference, but aggregated up across a population, it does matter. It really, really matters. And obviously, underneath the death will also be severe hospitalisation as a result of the new variant. So it's a relatively small but definitely not trivial increase in the severity of the illness that the new variant causes. As I say, it's still causing the virus as a whole is still causing a significant number of deaths. It's exceptionally transmissible. The new variant, which is well more than 60% of all cases, is even more transmissible than exceptionally transmissible, and it still kills in the order of 1% of all those that become poorly with it. So that is not insignificant, and we remain in really, really rather difficult position as a city. So then on to vaccination. Well over 50,000 people have been vaccinated today across the primary care networks and the hospital hub. That is an amazing effort, a significant effort that's been achieved by the NHS with support from all sorts of other people. We've vaccinated more than 70% of the over 80s. Most care home residents and staff have been vaccinated now, and we're on course to have vaccinated the top 4 priority cohorts by the middle of February, assuming that the vaccine supply continues. Certainly wait to be called by your GP. We're working through the priority order in a certain way, and that's the national priority order is set by the Joint Committee on Vaccinations. So please don't call your GP. Do wait to be called. We're going as fast as we can on that one. It's definitively the case that vaccination reduces the risk of severe illness and death in those that have been vaccinated, and that remains the case. It may not reduce transmission, and if being vaccinated does reduce transmission, it may not reduce it by 100%. No one knows the actual extent to which being vaccinated reduces transmission, somewhere between 0 and 100%. And clearly that's not a very helpful estimate. We can speculate all day about what the number is. The general consensus amongst the body of science at the moment is that being vaccinated will probably reduce risk of transmission, but we genuinely don't know that. Thus, you should still continue to obey the guidelines even after you've been vaccinated for a number of really important reasons. We need full coverage across the whole population. Remember that this is an illness that causes significant harm in many younger people, hospitalisations as I've mentioned, also the risk of long COVID. So we need as many people vaccinated as possible. And if we all don't obey the rules once we've been vaccinated, that may simply just increase the rate of transmission across the population as a whole that will have consequences for those who haven't yet been vaccinated. Also, unmitigated transmission across a whole population may lead to, will lead to significant harm and may lead to a mutation risk, because the more times the virus replicates, the more chances there are for a mutation. So in some respects we're playing with fire, and for that reason we really, really, really need to, 1, get the whole population vaccinated as soon as possible, and 2, until we're really clear and really sure about transmission risk, continue to stick with the programme. Wash your hands, keep your distance, limit the number of social contacts and face covering. So stick with that programme. Looking to the future, I expect the situation will ease a bit into spring. There's significant uncertainty about how the mutation will play out. There's significant risk that we still have a high rate of transmission. Lots of people are telling me that they see busy high streets, busy parks. My sense is that many to most are observing the restrictions. Thank you for that, because that has made a difference and that will save lives. But as I say, many people are telling me that they see places that are really busy. So it's obvious that some aren't. It is in all of our interests to limit the amount and extent of social contact we have. The rules are there for a reason. Remember, we are in lockdown, and lockdown comes with certain and specific rules. It's in all of our interests to get rates as low as we can. It may not be your loved ones that are affected by the passage of the virus from one person to another, from you to somebody else, or from somebody else to you, as you walk up and down a high street. That still is possible. It's low risk, but it's still possible. So it may not be your loved ones that are affected, but somebody else's loved ones will be. So I encourage everybody, please, to stick with the programme, stick with the guidelines, and stick with the rules for the foreseeable future.